Well, thanks all for joining us. We are going to have a great discussion about some tricky questions this afternoon, and joining me are experts from primary care who work for OnExamination, and also experts from secondary care from OnExamination. We're going to have a look at a question to start with, which is probably a topic close to lots of people's hearts, and it involves how technology or new technology in healthcare is introduced and how we can use it safely with confidentiality, but also use it to improve care for patients really ultimately. And I think this is a question you've written, Vivek.
That's right.
Do you mind just briefly discussing what the question involves, and then we'll go through some of the answer options?
Sure. So I can read out the question. So while doing a night shift as an FY2 in general medicine, a patient reports palpitations. An ECG was performed. You're sure the ECG is not normal, but you're not quite sure of the diagnosis. After speaking to the on-call cardiology registrar in another hospital, he asks you to send a photo of the ECG via WhatsApp, an instant messaging platform. Your trust has advised against the use of the software for patient-related matters. So it's really talking about you're a junior doctor, you've got an ECG you're not sure about, and spoken for getting advice from the on-call registrar, and he's not there, so he wants you to send a photo over an instant messaging platform.
And it's a great question because this is how services are often set up, especially nowadays, more and more centralisation. So this specialist, who's a cardiologist in this scenario, is at a different site, which happens a lot. And it's a time-critical diagnosis or decision, really, by the sounds of it. Palpitations in somebody, it's perhaps out of hours even. So it's a great question for those reasons. What do you guys think? What's your initial...
Well, for a start, Trust has advised against this very action. So I'm not going to do something that is going to get me into trouble for a start. But the ECG is abnormal. So it is potentially time critical.
So in terms of strategies, that's quite nice because obviously questions are important for content, but as well as that strategies to answer. So that's quite a nice thing you've hit upon in that you're going to default to the advice from the trust. And so in terms of the answer options, you may already be able to shimmy down the list some of the ones which are there, perhaps. So that's quite nice in itself.
Yeah. Certainly taking no action and repeating the ECG the next day would be inadvisable. So that would be fairly low down in my priorities.
And perhaps it's a good time to talk through all of the answer options. Obviously, in reality, there's a million options you could do, but in the SJT exam, they specify that in 5 or 6 answer options. In this case, it's an ordered question rather than 3 from 8, which is the other option. Vivek, do you want to just go through the answer options that you've written?
So these are in no specific order. So option A, send a photo of the ECG without any patient identifiable details. Option B, ask the registrar if you can fax the ECG instead. Option C, tell the registrar that you're going to fax the ECG instead. D, take no action and repeat the ECG the next day. And E, tell the registrar you don't own a smartphone and ask if you can send this photo via fax.
So it sounds like from the way Gary's attacking this, he's been able to, through using strategy really, actually, been able to probably downgrade 2 of those answer options immediately because of the feeling about the trust and also the feeling that this is a time-critical decision. So I'm guessing in your head, Gary, if you were sitting this exam now, you would shimmy down the list, repeat the next day because you think that's clinically inappropriate, and you would put down the bottom of the list, send it because that's what the trust says you can't do.
Yeah.
Any dissent about that?
No,
you disagree?
I think this is the point where candidates sitting exams start to get confused and start to get scrambled. And there are a couple of important points that we've picked out in the discussion already, really. If I was approaching a question like this, one of the things I say to students as soon as they start, or people sit in the exam, is to first of all extract the most important information out of the question. So with the question, you'll have a paragraph of potential waffle, but in it there'll be key points. Gary's highlighted those already. So the key point is you need some sort of information from somebody. You need advice on this. You don't know the best way forward, and that advice is time critical. The second thing is the do not do here is to send it via WhatsApp. So those two things, you have to identify those at the outset. Before you look at these options, think about the possible answers that you would put down for this, even before you look at them. Because what tends to happen is candidates look at the options, and then they get a bit, oh, well, maybe it should be this one, maybe it should be that one. So if you think about what the answer should be, if you think that, right, look for an option where you've got an option to get advice straight away. Select that one first, if it's a safe way. And your last option is going to be doing something against the trust or doing something against GMC guidance. Vivek's been very good in giving a little bit of a clue here in that it's against trust policy to send it via WhatsApp. You may get a question where you perhaps haven't got that information and some level of knowledge of GMC guidance, good medical practice is required.
Yep.
So I think when you're revising for these, the GMC guidance is really, really important. The examination bodies tend to go for national guidance rather than individual guidance. Sometimes there's a conflict, but not with this topic usually. Extract the most important points out of the introduction. Think what options would you put down if that were the case, and then look at the options. And then your first and last is usually fairly straightforward. The difficulty is often with those middle options, and that may be where we differ. It's difficult writing questions and picking those middle options, and sometimes it's just a question of opinion, really, and you just have to go with safety, and you know that's the best way to approach it, really.
So shall we hang our hats on what order we are going to put those two options which we don't like at the bottom, which are effectively going to be send the image, even though it's got no identifiable details, and do no action and repeat the next day. So presumably, are we saying one of those is going to be at the very bottom and one of them perhaps last but one? Where would you hang your hat on, and how do you decide whether you're going to break, and I'm not saying this is advisable, but in terms of the order, break a policy versus do something which may be more clinically helpful rather than do no action?
I personally, with a patient in front of me, want to do something about this patient's problem. So taking no action for me would be inappropriate, and I would be willing to break the rules only after that consideration, really.
Yeah, and I think that's great, you know, patient-centred care. And some of the difficulty we get in terms of feedback from an examination is, for example, if we put take no action as the least favourable option, and the next one being, you know, send this image, people will say, well, you shouldn't send the image. And say, well, absolutely you shouldn't. None of these, we're not saying these are what you should do. We're saying these are the order of preference for these options. Maybe none of them are right, actually, but what we're saying is this is the order. So it sounds as if Gary's going to go for the very bottom action, the least appropriate, being do no action, and the next one up being send this image, even though you've removed patient identifiable details. Do you agree, Geraint?
Yeah, that's absolutely going to be my option, really. Take no action is definitely the last one in my view. The interesting perspective on this really is send the ECG without patient identifiable details. That opens a right can of worms, really, because you're not identifying the patient. There's no way of matching that ECG to the patient, and so in many respects, I wouldn't have thought you're breaking any guidance in doing that. If you'd had patient identifiable details, it would be.
The difficulty is, you said about extracting important information, that last line is quite telling. Your trust has advised against the use of this software for patient-related matters.
Yes,
and so it doesn't specify anonymity.
Yes, exactly. And I guess, and that was the thing I was going to come on to, is that the problem with this is that there may be other issues beyond patient confidentiality where sending images can be a problem. Maybe they're not happy about the quality of the images going across, and I thought that'd be an issue with WhatsApp. But more importantly, if a registrar is perhaps giving this advice to lots of different people, and he's getting lots of different ECGs without any patient identifiable information, there's potential there for error.
And it's also very easy to send a message to a wrong person.
The wrong person,
You might be sending it to the chief executive of the trust. If you've got his phone number.
Yeah, so what you're saying really is anonymity carries risks in itself, i.e. he may have got 2 ECGs which are anonymous, one which has a devastating arrhythmia that needs urgent intervention, one which is very benign, and actually without patient identifiable information, that's what we do when we first check scans and tests, isn't it? You get the easy marks for right patient, right source, right date, and without those that safeguarding is gone. So we can kind of cross off 2 options. We've done a load of hard work already. Now comes the nitty gritty. So the answers remaining. Vivek, can you just go through the remaining ones we need to?
Yeah, of course. So it's ask the registrar if you can fax the ECG instead, tell the registrar you're going to fax the ECG instead, and tell the registrar that you don't own a smartphone and ask if you can send this photo via fax.
So again, with these questions, the answer options, you can almost classify those in 2 ways. One is a lie, one is a request, and one is an instruction. So in fact, the words almost don't matter in a way, and when you put it like that, when you action them in terms of an action, a request, a lie, it may stand out, which again is the least preferable to do. Any gut feelings?
So the third least preferable would be obviously an untruth or losing your integrity. So it would be telling the registrar that you don't own a smartphone. And for me then the last 2 really are out of working with a colleague and get a colleague on side, and perhaps making life more difficult by telling a colleague what you need to do. Yeah, you may actually need to tell a colleague if he's got different views on it, but actually the best thing to do in the first instance would be to ask the registrar to fax the ECG instead, in my guess. So that would be my first choice. And these again are good examples. We get a lot of support queries from candidates about these questions, and we've touched on it earlier on in the discussion. Sometimes candidates get themselves into the mindset that there's one correct answer and the rest have to be incorrect, and it really isn't. And you've got to get yourself into the practice of looking at these in terms of prioritization. There's a best answer, there's a least appropriate answer, and then it's judging degrees of inappropriateness or appropriateness then with the rest of them.
Yeah, so that's really nice. Again, we classifying it as those 3 ways, including a lie, makes it stand out. I'm not going to do that. So the lie is the least preferable, and I suspect those 2 are the top 2. That's when the bun fight happens, really. You know, do you just do it or do you ask? I guess playing devil's advocate, if you ask, it may be that the registrar says, oh no, we've actually got a secure system of doing so. It's a bit more hassle to do. Please can you use this? Or actually, I can come off site and come over there. So I guess that opens up the discussion and simply telling him you are going to perhaps closes that discussion. So that would probably be my gut instinct as well, although again I think it's entirely reasonable to have a debate about those 2. You can equally say that you're not going to do anything you're not happy with, and you think the right thing to do is to fax it, and so that's what you're going to do.
It's interesting when you're writing questions and you're putting them into the public domain. Vivek has actually written the question, and he, in his mind, knows what the correct order is. Before going online or out in the public domain, does each question have a committee to discuss the correct order? And when most of that committee are in accordance, you then put it online, and then once it's out and used live, on the basis of the user opinion, do you actually change the order of the intermediate ones based on what the customers feel?
Yeah, it's a great question. So SJTs in general, unlike other questions, are decided by committee, and we have got a process of doing that. We've also interacted with various medical protection societies in the past to do that as a third eye. So these kind of questions they do change, and especially questions related to things like new technology, guidelines do come out. And so if in a year's time the GMC release a guideline saying WhatsApp is now an accepted, accredited provider to transmit data because of a new agreement, then obviously this question would have to change. So yes, they do need to change. Using the knowledge of our customers and crowdsourcing that is important because they often know this information and can feed that back to us. Do we simply change according to their decisions? I think that's variable and it's on a case-by-case basis. What it does is it flags up to us, like there's some disagreement, perhaps it needs to come back and have a discussion like this.
They're continuously reviewed with the primary care exams. They're continuously reviewing the questions, and they are decided. These particular questions are decided on a group basis with a committee. But the answer stats are important because we like the answers to be. We like it to be a reasonable and fair test, and some questions aren't as well written, and if the answer stats suggest that, then we look again at them and think, well, okay, a lot of people are opting for this. Is it reasonable? Is there something in the wording of this? And sometimes people give us examples as well. As clinicians, or experienced clinicians, you tend to look at a particular scenario with a particular perspective. And sometimes somebody who's not used to being in that situation looks at it with completely fresh eyes, and they just interpret that question in a different way. And if any ambiguity comes to light, where we think, all right, actually, we can see perhaps maybe people are looking at it in a different way, not in the way that we intended, then we'll amend the word in the question.
Because I will look at question stats, and if the answer is not what I think it should be, then I think there may be a problem with the question.
Yes.
And I give the users the benefit of the doubt and reassess that question, and if necessary, either rewrite a part of the question, or by taking on board what they said, maybe tweak the order of the answers.
And the examination boards do this as well. They'll set an examination, and sometimes candidates will come out from an examination and say, "Oh, did you see question 36? It's absolutely impossible. How do you answer that?" And they look at them, and if really that question is just not doing what it should be doing, and the stats suggest otherwise, they may pull the question and take it up to
and you can look at a question for hours, and it's then seen by a different set of eyes and interpret in a different way. So sometimes the question is at fault.
And just to be clear for users, the committee we use, and indeed the section editors we have, is a balanced group of people with all different ages, a pretty good gender balance. Sadly, many of our female colleagues can't be here today, but it's not by any means a very self-selected small group. It's a very balanced group, and similarly reflecting our users, really. So Vivek, you're going to put us out of our excitement and our misery. So I think we've come to a decision on the order. The thing we're least sure of, I guess, is those top two answers, whether it's request or tell. I suspect that's where there may be discussions. But
well, I think he's the on-call cardiology registrar. I would like to ask for his opinion.
Great.
No, I'm in complete agreement. So that's exactly where I was going with it as well. And I saw no reason why at the very least, you wouldn't ask first. And if he said, no, I don't care, faxes take too long, I don't like it, at that point, one might argue, look, I don't feel safe, but there's no reason, in my mind, why you tell him before asking. In terms of taking no action, I mean, the question was intentionally vague in terms of palpitations, because do they have chest pain, lightheadedness, loss of consciousness? And so taking no action with such little information just seemed reckless to me, which is why I kept it at the bottom. And in terms of that sentence, your trust is advised against the use of this software. The reason that sentence was put in the initial blurb was when you read down the useful resources section and see the kind of the guidance on instant messaging in the hospital, in healthcare, but particularly the hospital, they say balance it out with pros and cons, basically. So if you're worried this is a patient and you don't know how to interpret an ST elevation, I'd rather you send a WhatsApp than leave it with some ambiguity. And I think that's what the guidance is saying. In more chronic settings, you'd probably argue against any kind of instant messaging. But if you're really worried and this is an acute situation, as the hospital often does, then even if, like you said, even if the trust says against it, if patient safety is involved, think about it.
If I can make a point right at the end with this as well, this question, because another good example, this brings out another really good learning point with this, and something that we get time and time again on support, is, and this applies to answering clinical questions as well as situation judgment questions for candidates. Don't waste time thinking about options or arguing options that are not there. Some candidates look at this question and they'll say, well, you could email it. Why don't you email it? Email's available. Most trusts will accept email. The secure email. You should be emailing. Why haven't you got an option for email? Forget about that. It's not an option. The question is asking about these options. Now, you may have thought about it in your preamble. If email's there, maybe that's an option. Should I pick that? But once you've looked at the options, keep your answers and your time focused on the options that are available to you. Don't worry about options that are not there. And the same thing applies to clinical questions as well.
That's nice, yeah.
And the other thing, these questions are carefully constructed, and read the question, and each word is important.
Perfect, thanks guys. I think we passed, is that right? Yeah, wonderful.